Awesome. So moving into our next session, as soon as the slide moves forward, oh, too far. There we go. So our next session is about fitness and nutrition, and we have two panelists joining us or two speakers joining us for this session. We have Chris Wynn, who is the founder, owner of Buckeye Wellness, and Angela Majerle, who is the clinical dietitian at MetroHealth. They are kind of teaming up to take on this session. So whenever you two are ready, you are welcome to join. Yeah, so whoever's going first and whenever, do anybody need to share a screen? Does anybody have?
Hi, Mag. How are you?
Good. How are you?
Good, good. I will be sharing screen. I'm not sure if Chris will. Chris, did you want to start off first with fitness and then I'll go into nutrition, or do you want me to take the lead and then you pick up with fitness?
Can you hear me, guys?
Yep.
All right. Am I up on the screen yet or no?
We can't see you.
All right. Just one sec. All right.
Hey, how are you?
I'm good. How are you?
Good.
Yeah, I can start first, and then we can kind of transition into nutrition since it kind of plays hand in hand. But yeah, I'd like to introduce myself. My name is Chris Wynn, and I am the owner of Buckeye Wellness Center. And just a little background on me. I broke my neck back in 1993. I am C4, C5 quad with C6 functional level. And back when I was injured, the doctor gave me a pretty bleak diagnosis. And basically I came through, he said I'd be on a ventilator and never move again. My life was spared. He did an excellent job saving my life, but he did attribute the fact that, I am still here because of the shape that I was in. I was always avid exercise, enthusiast, very active. When I broke my neck, I was in Hawaii, so I spent a lot of time outdoors doing things. So the reasons for opening Buckeye Wellness Center was a trip that I went out to California. I found a place that it was a rehab facility, and they kind of started this whole approach to treatment of working below the level of injury in order to improve function and give the best possible shot at some sort of recovery by this approach to therapy that involved weight-bearing exercises, neural pattern movement, standing, gait training, and such. So upon coming back from California, I looked for facilities in the area that just didn't exist. And, it's just everybody is looking to improve as much as they possibly can after therapy. But the problem is where you go. There was no place. And at that point, when I went out to California, I was already 14 years into my injury because I was injured in 1993. So just based on my experience and seeing the individuals that had spinal cord injuries, there was one that was a C6-7 quadriplegic. He was considered complete at the time. He was 10 years post-injury, and after a little over a year of being treated at this facility, he was up walking with canes, and it blew my mind. There was another individual that flew all the way from England for treatment at this center, and he too was up walking with assistance. So, it's just, I came back from California, and I didn't want this to be a wasted experience. So I had grants available to me through the VA and through the state of Ohio for self-employment, and I had to write a successful business plan. So I started this whole process in 2007, shortly after I returned from Hawaii, and it wasn't until 2011 that everything got approved through the state of Ohio, and through the Veterans Administration. They paid for close to $100,000 of equipment, and we opened September of 2011. So Buckeye Wellness Center, we offer a few programs. First, one of our more popular programs is the one-on-one therapy sessions. It's an hour session, and what we do is we assess an individual, and we currently started doing like a free assessment as long as one session is paid for in advance for a following session. So we'll go over, pretty much head to toe, assess those individual weaknesses, strengths, what that person's goals are, and we will come up with a program to work on for that particular individual. So, like I said, new injuries coming out of rehab, of course, they want as much return as possible. So, we incorporate these weight-bearing exercises, and these exercises such as like gait training, getting on hands and knees, standing frame, even start individuals like helping them crawl. Even if they can't go through the motions, our trainer will help them, guide them, and basically be their central nervous system and walk them through these activities. And this is based on a concept called it's been proven that it's called neuroplasticity, and it basically is the central nervous system creating new neural pathways to find a way past that point of injury, to try and get the body corrected. Now, every injury is different. We don't guarantee that anybody's going to walk, but what we do is try and give that person the best shot available. So we've had some individuals that have gotten up out of their chair walking, and it's just rewarding. Like I said, there's no guarantee, and we don't promise anything, but we certainly have that individual's goals and best interests in mind when we come up with these programs. So the one criteria before participating in a program like this is, a year post injury, there's chances of a decrease in bone density. So a bone density exam is recommended before starting in a program like this. We don't want to put anybody in unnecessary risk of fractures or anything like that. But we may get somebody that's far into their injury, and their goals may be different. Like weight loss, it's so easy to gain weight after a spinal cord injury, or just strengthening. But same process. We assess that individual, evaluate their weaknesses and what they want to work on. But if it's somebody that's interested in weight loss, you know, we're going to talk about their diet and nutrition and maybe some changes that they can make in combination with exercise to help them through that process. It's going to be slower, it's going to be harder. Like the VA, for example, was doing a weight loss program where I believe the guidelines were, you know, 1,500 calorie a day in combination with, you know, cardio exercise. But overall, I believe everybody in their group lost some amount of weight. The one thing that I learned is an important number to know is your resting metabolic rate. I had Dr. Sparks from Cleveland State University come out to Buckeye, and he measured my resting metabolic rate. So at rest, I'm only burning 960 calories. So if I'm not doing any sort of exercise, my caloric intake doesn't need to be that much. So, you know, if I am exercising and I want to build muscle mass, you know, it's important to incorporate protein into your diet and just watch what you eat. So, you know, we always give some sort of guidelines and recommend, you know, the technology out there, the fitness apps to track that type of thing, because it can monitor, you know, monitor food, it monitors, you know, calories and fat, sodium, those types of things. So, you know, we can kind of guide you along that, you know, that path to weight loss and strengthening. You know, I mean, weak core is a common thing that people like to work on. So, but you know, I mean, we get people out of their chairs, we transfer them onto different equipment. You know, mat tables. You know, we've got the standing frames, and we do have cardio equipment. And it doesn't matter if you have hand grasp or not. We have grip assist type things to hook you up to all this equipment. So, you know, we can work with, you know, various different levels of injury. You know, one is like a crank cycle. It's like a hand cycle. It's a little bit different from the ergometer. The positions of the hands put less stress on the elbows, which I found, you know, when I used the ergometer, it burned my elbows out, so I couldn't use it. But, you know, even if you don't have, you know, machines or anything at home to work with, you know, I used to use the Nintendo Wii, and I'd box for like 45 minutes to an hour for my cardio. You know, or, you know, use exercise bands for strengthening. So, you know, if you are at home, there's things that you can do, and, you know, and we can recommend at-home exercise programs for you as well. So the other thing that we do have that people will come in and use is the RT300. It's a FES bike, and it's functional electrical stimulation. It's topical electrodes that we put on various muscles of the legs or arms to pedal a bike. I mean, the criteria is that your muscles have to react to electrical stimulation, but we evaluate you and we go through those tests to make sure you're a candidate for utilizing this piece of equipment. There's a lot of benefits to incorporating this. Now, if you're a one-on-one client, you know, purchasing sessions, you know, we can incorporate the RT300, or you can come in and use it separately. So that's an option as well. But by using the RT300, as long as your muscles react to electrical stimulation, benefits would be like reduction in spasticity, build muscle mass. There's decreased potential for pressure sores and increased blood flow, you know, the range of motion in the hips. So yeah, there's a lot of benefits to using that piece of equipment. And I found when I use it, just trying to push as hard as as I can, even though I don't have volitional movement in my legs. It turned out to be a cardio piece for me as well. So, so yeah, it's just it's a great piece of equipment that we have. So, so basically, you know, other benefits from the one-on-one therapy is, you know, we do range of motion on all of our clients prior to working with them. So, you know, I don't know, I'm lucky enough to have an aid like Hanan had mentioned, and thank you, Hanan, for the plugs. I really appreciate it. But finding an aid that's going to do these things for you can be a challenge. You know, I'm lucky enough that I have a wonderful individual, and she takes very good care of me. The first thing I do every morning is range motion before I even get up in a wheelchair, but not everybody has access to that. So, you know, we get individuals out of their chair, we do range of motion on them. We try and keep those muscles loose, flexible, limber to prevent contractions, because, you know, that can be a common problem with spinal cord injuries. You know, you sit in your chair for so long throughout the day, and, you know, muscles can conform to sitting very quickly, and, you know, before you know it, you know, you're very tight. You know, I've experienced tightness in the upper body, the back, and around my ribs and things like that. So, you know, I recommend like laying on your stomach to just kind of reverse the effects of being in a seated position. But, you know, things like that. And I mean, there's other things that are benefits. You know, we may spot problems on an individual before they even know they have one. You know, we pressure sore sometimes. We can identify pressure points on the chair that may be causing an issue, swelling in certain areas that people don't know they have, or other things like fixes to chairs. You know, I usually carry a full set of Allen wrenches on me. So there's been times where people need adjustments on their chairs, and I've been in a chair for almost 28 years. So I've had enough experience to know where most common adjustments are made and how they're made. So, you know, we can help people with that. That way you don't have to go through insurance or, you know, go through a medical supply provider. You know, we can make those simple fixes for you. Then another program we have is general gym memberships, and they come in and they're able to utilize the equipment that we have. As long as we're not using it for our one-on-one clients, you know, you can get in a standing frame, you can utilize our cardio pieces, you can use our strength training equipment. And again, it doesn't matter your level of injury. We do have grip assists. We do have people there that can help for the most part, as long as they're not working with the client. You know, everybody's pretty much open to helping other people in the gym. So, so you know, it's really not an issue if you do need help. But like Hanan had mentioned, we're a super close group. You know, we've got each other's backs, and you know, sometimes the mental challenges are more than the physical. You know, maybe it's pain related. You know, you got bowel or bladder issues, or you know, sexual function things that you're worried about, relationship issues, or a lack of resources. There's you know, there's no shortage of people to talk to, and like I said, we're a very close knit group of people. But you know, I can guarantee you that, you know, you will find somebody that you feel comfortable talking to, whether it's myself or another gym member. But you know, it's a important relationship that we all have, because if you don't have a book of resources. If you need help with, home health aides, maybe somebody's got an agency that they're having success with, or, if you're having problems with some of the other issues that I mentioned, there's a number of people in there that have been through, what you're going through, and we can help you out with that, and we're here for family members as well, because, it's, we're not the only ones going through it. The family members are there a lot of times and are very involved, and, they need support too. So there's been many times where, my wife, she's been in the office and, she's cried with other mothers and things like that for people that have been struggling, and, they don't know where to turn, or, for certain things. So, like I said, I've been in a chair for a long time, and, if I don't have an answer to something, one of our members probably will. And if we don't, we can guide you through that. We'll help you through it. We're all going through the same thing. So there's really no reason to feel uncomfortable or anything like that. Yeah, I'd like to also sincerely thank Lisa Lombardo and John McDaniel. Just recently, and the Craig H. Nielsen Foundation, during the COVID crisis, they were giving out emergency grants. And Lisa Lombardo and John McDaniel helped write a grant that gave Buckeye $10,000 to purchase at-home exercise equipment for our members. It helped 20 plus members of our facility get at-home exercise equipment. And I can't thank them enough for helping us out. Without the ability to come into the gym, we were closed down for a while. It just meant so much to myself and to all of our members who received equipment. So the Craig H. Nielsen Foundation, they do so much for the spinal cord community. I'd also like to mention that we, and I'm sorry, Zach, but we just, I had a meeting with Parker Hannafin yesterday. They're manufacturers of the Indigo exoskeleton. And we are going to start having clinic days at Buckeye Wellness Center, where I've got the paperwork that you can have your doctor fill out to make sure that you're able to use one of these walking devices. But we will be able to have clinic days for individuals to try these things out at Buckeye Wellness Center. So between that and the RG300, that's also a place where you can come and try out the FES bike. We can get physical therapists involved from the company if you're able to get an at-home unit, or if you're just looking to try it out outside of a clinical environment. I believe we're the only place in the state of Ohio where you can come to try these types of things out. So yeah, I believe my time is up. But again, when it comes to working out in the gym, I can't stress enough how much nutrition plays a role in your health. And Angela's going to touch more on that. But again, I mean, it's so easy to gain weight in a chair, and then that can lead to a whole lot of consequences down the road. So, if we can kind of nip these things in the bud before problems start, then, that's what we're here for. We're here to help. So more information can be found on our website, BuckeyeWellnessCenter.com. And chances are, if you do come into our facility, you will probably run into somebody that you already know from Metro. So Megan, I'd like to thank you for the opportunity to present. I sincerely appreciate it.
Great. Thank you, Chris. That was excellent. And that's an excellent program that you have. And I know that our patients have taken advantage of it. I had one question before I jumped in,
Sure.
and that is, I wanted to ask about membership. So sometimes, like you had mentioned, oftentimes folks are dealing with limited resources. Do you have anything in place like for hardship programs or scholarships they can apply for to help with the membership costs at all? Or have you partnered with something like, say, Silver Sneakers or Silver and Fit or anything like that?
Scott Fedor, I know you probably know Scott. He has an organization called gettingbackedup.org, and you can apply to his foundation for assistance with exercise-based programs like ours.
Excellent.
He awards a certain amount to individuals like every quarter. So there's that. We're currently in the works of potentially starting a separate nonprofit to raise funds for like equipment and potentially scholarship programs for individuals. Our general gym memberships are affordable. They're $43.20 a month. That includes tax. Our one-on-one sessions are $80 an hour. We try to keep that, as low as we can. And, if you do research, but, for these types of facilities throughout the country, pretty much the going rate is 100. I understand that people have limited resources, and so we try, to keep that rate as low as possible. So, I do understand, and that's why, we're trying to come up with more resources so people have access to this.
That's excellent. Thank you.
Oh, you're very
Thanks
welcome.
for sharing.
Sure.
All right. Feel free to pipe in anything that I'm saying about nutrition that you want to offer. Jump in.
All right.
Okay. All right. I'm going to go ahead and share screen. Okay. And let me see. I think I go here. Okay. And then how's that? Do you guys still see like the full screen slide?
No, we see your presenter view.
Ah, that's not what I wanted. Okay. So can I escape? We'll go see here. Come on. Okay, since we're paused. Okay. All right, so Chris had started out and he shared why nutrition is so important after spinal cord injury, and there's lots of really good reasons why it's important. One of the biggest things is, unfortunately, after a spinal cord injury, we find ourselves at increased risk for diabetes, high cholesterol, and obesity. We call that kind of metabolic syndrome. And that's, again, because we're at high risk for unwanted weight gain. And a lot of that weight gain ends up abdominal. And when we put that abdominal gain on, it's added, unfortunately, adipose tissue, fat around our abdominal organs. And that's what puts us at this increased risk for diabetes, high cholesterol, obesity, and heart disease, really. We're also at increased risk for developing pressure ulcers. Chris had touched on that as well. So I'm going to talk a little bit about that, and at increased risk for osteoporosis. Oftentimes, folks wonder how much should they weigh after a spinal cord injury. And, we always talk about ideal body weight and all of that. Ideal body weight is kind of a funny number. It's based on these metropolitan life charts of, healthy young men, but we apply it to the entire population. So I kind of take these with a grain of salt, but it's what the best that we've got is in the literature right now. And individuals with paraplegia should weigh about 5 to 10% less than those guidelines. I'll go through those numbers with you in a second. And folks with tetraplegia or quadriplegia should weigh about 10 to 15% less than the guidelines. Perhaps a better measure would be BMI, because that really looks at the comparison of adipose tissue to muscle, and looks at both your height and your weight in proportion to each other. For general population, a BMI of greater than 22 or greater than 25 defines overweight, and then greater than 30 puts us in obesity category 1. For individuals with spinal cord injury, a BMI of 22 defines obesity. So you can tell that that's a big difference. And it's something to keep in mind, because it takes into account our muscle as well, and decreased muscle tone after SCI. So how do we calculate a body weight? There's a couple of calculations that we use, one for men, one for women. For women, ideal body weight is starts off at 100 pounds for the first 5 feet of height. And then we add 5 pounds for every inch after that. So, and then when we're talking about SCI, we'll subtract 5 to 15% depending on the level of injury. So if we look at an example, a young lady that might be 5 foot 5 inches tall, her ideal body weight would be 125 pounds. So 100 pounds for the first 5 feet, and then 5 for every inch after. And then if she has paraplegia, we would subtract 5%. So 5% of 125 is 6.25 pounds. So the ideal body weight would be 118.75. And if she has quadriplegia, then we'd subtract 10%, and the ideal body weight would be about 112.5. And usually when I look at ideal body weight, I look at like up or down 10%, because everyone is individual, and of course the level of activity plays into that as well. So for men, it's just a little bit different. We start off with 106 pounds for the first 5 feet of height, and then 6 pounds for every inch after that. So an example would be a male 5 foot 10 inches tall. Baseline, we'd be at 166 pounds. So 106 pounds for the first 5 feet, and then 66 pounds for 60 pounds for the next 10 inches, puts us at 166 pounds. When we subtract 5% for para, we're at about 157 pounds, and then 10% for tetra, it's 149, or about 150 pounds. And again, plus or minus 10%. So that kind of gives you a ballpark when we're talking about ideal body range. And that's important because we use ideal body range when we're calculating estimated needs, which takes us to the next slide. So how many calories do we need? What research or literature is suggesting that for normal weight maintenance, so just to stay at the weight that we're at, we are looking at about 28 calories per kilogram of that ideal body weight. So we really got to start off with the ideal body weight first. And that would be for para. And then for tetraplegia, 23 calories per kilogram of the ideal body weight. So now you're probably thinking, well, wait a second, we were just in pounds. How do I know how many kilograms I am? And you probably never thought that this was going to be a math class. But we've got to be able to convert from pounds to kilograms. Most of our measurements, our calculations are in kilograms. The conversion rate is 2.2. So there's 2.2 pounds in every 1 kilogram. So if we go back to someone's ideal body weight, we've calculated it to be 150 pounds, and divide that by 2.2, that means that individual weighs 68.1 kilograms. Then we would multiply that by how many calories they would need for weight maintenance based on their injury. And this does sound a lot, 1,900 calories, or even 1566, especially after Chris suggested that your resting metabolic rate could be as low as 900 or in that 1,000 calorie range. So this is, like I said, based on weight maintenance. It really depends on your activity and your desires. If we're looking at losing weight, if we're looking at if there's a large wound that we're trying to heal and close up, all of those are going to play into effect as well. When we are talking about weight loss, what we want to do is more math. We want to subtract about 300 to 500 calories per day from that goal that we started out with. So if we go back to that 150-pound individual that we calculated needs about 1,900 calories for weight maintenance, we want to shave off about 300 to 500 calories per day to promote weight loss. So now that new goal for someone, say at 150 pounds that has paraplegia, might be closer to 1,400 or 1,400 to 1,600 per day, or the individual with tetraplegia may only need a little over 1,000 calories or under 1,300 per day. So you can see that it really makes it kind of tight, and is very different than how many of us, are eating prior to injury. And I think that's the biggest change there, is looking at what our normal caloric intake is and then recognizing how many fewer calories we need now that we're not burning as many calories and using as much muscle. And then when we look at protein, protein is so important. It's the building block for our body. And when we are in any kind of stressful situation, so whether it's an injury, whether it's a wound, even if we're talking about, an acute stress like upper respiratory infection or anything like that, protein is our building block. And that goes kind of to that area of injury first to help heal it. That's important to know, because if we're not consuming enough protein, then our body will, it's very smart. It will break down our own muscle mass to promote healing. So you could be compromising your own existing muscle mass to promote healing, say, of a wound or an injury of other sort, if we're not consuming enough protein. Protein also is important because it helps to keep us feel full longer. So it really contributes to satiety. And that's important if we're cutting back on calories. If we're going to cut back on calories, we still want to feel full and not be searching for something. We don't want to be competing with that hunger and hunger pains. General guidelines, again, we're basing them on kilograms. So take your weight, and then we want to divide that by 2.2. General guidelines, if there's no skin breakdown and you're not looking to build muscle, you're not working on weights or anything like that, would be about 0.8 to 1 gram per kilogram. So for that 150-pound individual, if they didn't have any skin breakdown, they're at about 68 kilos. So their goal is probably around 65 to 68 grams per day of protein. Now, if there is an ulcer present, so if there's a stage 2, then we want to bump that to 1.2 to 1.5. And I would say if you're exercising, if you're looking to build more muscle, then I would definitely start at about 1.2 to 1.5. If there's a larger wound present, so a stage 3 or stage 4, then we could be looking at as high as 2 grams of protein per kilogram to really promote healing and preserve our own muscle mass in the process. So Chris talked a lot about exercise. Exercise is important for so many reasons. And I always say, if I could put the benefits of exercise in a pill, I could be a millionaire. Because exercise contributes so much. One, it helps keep our weight under control. It has to be part of the equation if we're looking to lose weight or maintain our weight. Exercise is part of that equation, or fitness. Exercise is important to help blood sugar stay under control as well. And that's a big deal. If we're at increased risk for diabetes, then we've got to find a way. We can't just rely on medication. part of controlling our blood sugars has to involve our nutrition plan and our fitness plan as well. It's a comprehensive program. Exercise also helps to keep our lipids under control. So this is important. Remember, we're at increased risk for metabolic syndrome. We want to keep those lipids under control. We want to keep the blood sugars under control. It's all this big, happy love triangle. And then exercise is so important in maintaining bone density. Chris had mentioned how important that is, and getting a bone scan, and exercise is critical in maintaining bone density. What's recommended is at least 30 minutes per day to promote weight loss, and I would probably wager and say we want to shoot for more than that, closer to 60 minutes per day, 5 days a week as possible. The nice thing about exercise is it doesn't all have to happen in one big chunk. So it could be 10 minutes several times a day. It could be 2 30-minute workouts, or if you're just getting started and your goal is to hit 30 minutes, you could break that down into increments. But and I read a statistic somewhere and I thought it was really cool. 30 minutes a day works out to only 2% of your whole day out of 24 hours. And so when you say, I don't have time for exercise, or I don't have time for myself, an important question is to ask, am I worth 2% of my time? And I believe that each one of you are, all of us are. An investment in yourself in this way is really to make you the best that you can be, not just for yourself, but for all those around you as well. Some exercise, tips if you're not able to get into a fitness center. Swimming and aquatics programs through the Y. They often have adaptable equipment, electrical stimulation, mall wheeling. Now that the malls are open again, using that as a safe, dry, warm, or cool place in the summertime to get some exercise is excellent. Participating in group wheelchair sports. And then on YouTube, there's some, YouTube has a wealth of information. There's some great videos and workouts there specifically for spinal cord injury. And then, like Chris had mentioned, using stretch bands, light weights, and things like that. And I think if you could get into Buckeye Fitness, that would be the best opportunity of all. Some additional tips for weight control. So it's important to allow for plenty of time to plan for your shopping trip and for your meals. When we find ourselves in a pinch, when we haven't planned very well, that's when we make poor choices. So if I know that I have an appointment or I'm going to be out of the house for a good chunk of my day, I might want to plan and bring a healthy snack along or pack something along so that I don't find myself getting really hungry at 2 in the afternoon and going for the drive-through or going for the vending machine. So a little bit of planning ahead of time helps us make better choices throughout the day. Don't skip meals, unless you're, now I am going to say there's a caveat with that. Unless you're deliberately trying a fasting program, and that's under, supervision, it has to be very deliberate, and that has to be planned as well, because it's not just about skipping meals, that's about the timing of when you are eating and how much you're eating during your eating allowance. But otherwise, skipping meals puts us in trouble. It affects our blood sugars. Our pancreas can't predict when we need to, crank out more insulin. It also puts us into storage mode. So sometimes, you hear people say, well, I only eat once a day, I can't seem to lose weight. And that's probably why you can't, because that metabolism is in storage mode. And it stores and holds on to everything because it says, I don't know when this guy's eating again. I need to be really fuel efficient. So not skipping meals is important. Shooting for routine, at least 3 meals per day, 3 to 5, ideally, if that's possible, again, if that fits into your routine. And then a really simple tool, I think, is using the plate method. If we're trying to figure out how many portions or how big should my portions be, the plate method is the easiest way to look at it. And that is looking at a 9-inch plate. So thinking of those plates we used to have when we were kids that are 9 inches, not giant. Divide that plate in half and make half of it vegetables. And I call them free vegetables, those that aren't starchy. So, you know, cauliflower, broccoli, green beans, all our greens, our lettuce, green peppers, tomatoes, cucumbers, all those good things, squash, summer squash, things like that. A quarter of your plate to be meat or your protein choice. So that could be fish, it could be meat, poultry, anything like that. And a quarter of your plate would be about the size of the palm of your hand. So we always have our hands with us. That's the size of protein we want to keep roughly. And then the last quarter of your plate to be your carbohydrates. So whether that's rice or pasta or potatoes or corn or beans or any combination, that's that last quarter. And again, we've got our, you know, our hand with us all the time. That's about the size of your fist. So if you can kind of keep that in mind for your measurements, it's an easy visual for when you're, you know, even eating out somewhere, it can help you out. Or when you're eating out, sometimes, you know, maybe they got really great bread and I'm going to get a big baked potato. At those times, compromise a little bit and choose, am I going to enjoy the bread more or will I enjoy the potato more? And, you know, bargain or have a little bit of both. Oftentimes I recommend to folks, if they're really going to enjoy the bread or they plan on having a dessert afterwards, then skip the starch with the entree and go for double vegetables. And that way you're making room for some of the things that you might enjoy more while really being conscious of your portions as well. So portion sizes, reading nutrition labels is important as well. Looking closely at that serving size, I think that that's important, and being honest about how many servings you're going to eat. A big area that we often miss is watching our beverages. And that is a tough spot because a lot of times we get into trouble not realizing how many calories we're consuming by way of beverages. So these are our fancy coffees, even some of our juice drinks, even some of the drinks that are promoted as healthy. So things like those naked shakes. I'll have folks come in and say, oh, I drink, you know, 1 or 2 of these a day. And they're really great because look at it, it's all green, it's all vegetables. But when you look at the label, you'll be shocked to see just how much sugar and carbohydrate is in that as well. Some of them can have as much as 11 grams of sugar. So let me just see. It looks like there's some activity in the chat. Okay. And then making sure that you're choosing lower fat and higher fiber foods. Okay, for some reason, my slide has frozen for a second. There we go. Chris had mentioned, and I have to agree, keeping a food diary or record is really, really key to success. Easy tools online are Lose It or MyFitnessPal. They're available on your smartphone, and also they're available as an online app as well. It's really important because these tools keep you honest. So that's why we want to include those as part of our plan. Even a written journal is useful if you're not, savvy and you're not interested in using an online app. Other nutrition factors associated with spinal cord injury, I mentioned briefly just heart disease. Some of the simple things we could do is know your numbers. We hear that all the time in media and that, but it's important. Know what your cholesterol, your good cholesterol, your bad cholesterol are. Even ask, what is your C-reactive protein? That is a marker of inflammation. Oftentimes when heart disease is present, there's inflammation present as well. So that's a really important marker. If you're a smoker, quit smoking. That'll protect your heart. Definitely choose more fish and omega-3 fatty acids. Those are found mostly in our fatty fish. So salmon, sardines, things like that. Megan, am I cutting into time? Am I going too far?
If you have just like another minute or two, that would be
okay. Okay. Bone health, I can't agree more. Making sure that you get a DEXA scan, know how much calcium you need, and then choosing calcium-rich foods. Also making sure that you're getting enough vitamin D. And believe it or not, it's only 15 minutes a day in the sun. We don't have to be outside sunbathing. And I know that that can be a challenge in Ohio sometimes because we're cloud covered. Making sure that you're getting lots and lots of fluid and that fiber, so important. Cranberry juice can help. There's some light research that suggests that cranberry juice, and I would suggest more cranberry supplements to help with bladder health. Cranberry juice could contribute to weight gain if we're drinking lots of it because of the sugar content. And here we are at the end. I don't know if there's any questions.
There was one in the chat. Smoothies.
Smoothies? I'm sorry, what was the question?
What about smoothies?
What about smoothies? Smoothies can be excellent. It depends on what they're made of. So I would suggest if you are making smoothies at home that you keep your portion size for your fruit. And I would suggest frozen fruit. I love that because it makes it more like a shake. But I mean, fresh fruit's excellent as well. Keeping your portion to about the size of a cup, or again, your fist for the fruit, and then making sure that you're including a protein. So whether that protein comes from a Greek-style yogurt, that's, again, I would recommend either fat-free or light, or whether that protein comes from a whey protein powder or a vegetable protein powder. You definitely want protein. Protein's your anchor, and it helps to keep you feel full. Liquid can be almond milk, regular milk, could be water, whatever you like. I would avoid juice as your liquid because we're just adding sugar calories. I think smoothies are excellent. They're an excellent way to get vegetables as well. You can throw in a handful of spinach and it really doesn't change the flavor of your smoothie, but to eat a handful of spinach would be a little bit tough. Smoothies are great as long as they're not your snack. You're using them as a meal replacement. You're not overdoing your fruit portion, and you're including protein.
And then Richard asked in the Q&A if there was literature.
Tell me again, I didn't hear you well.
Is there literature for this?
Literature for this, meaning like like handouts or slides, or? Or reference points, are you asking about references for?
Yes, to references, I believe.
References? I could, Megan, I can get references to you and then you could share them with the group.
And if you don't mind sharing the slides with us, I will put them in a place that people can access.
Sure.
Okay, the last question before we move on, Angela will be back this afternoon for the Ask the Medical panel. So if there are more questions for Angela after lunch, keep them in mind while we take a break. But the last question before we move on is, considering the challenges for healthy food prep for spinal cord injury community, are there any resources or tips to make easier cooking or even buying from healthy meal delivery subscription companies?
So my recommendation, I guess, would be, I agree. I think that the healthy meal delivery companies or the meal prep companies are a great idea because my understanding is that a lot of them come already prepped, chopped, and you get the recipe and you're combining that. So that is a super solution. Unfortunately, it's a very expensive solution also a lot of times. I know that EXO, I believe, has a lot of tools and kitchen gadgets that are really helpful because they have the rubber bottom on them, and so they don't slide as much, and they're really helpful tools. I've researched a little bit on YouTube, and I've seen some good resources there and videos, and I could probably take a look before the 1:30 session, maybe pull up a couple of links. But I refer a lot of folks to YouTube quite a bit because I think it's a great spot where individuals can share some tips and even recipes and all sorts of things like that that are real specific to that. But I'll take a look on YouTube if there's any, really cool video or.
Awesome. Well, Chris and Angela, thank you so much. That was wonderful and so much awesome information. We really, really appreciate you guys doing this session for us.
Thank you. Thanks for having us.
Okay. Before I do that.